Statistically, the #1 cause for nipple pain after a baby's 2 weeks old is an overgrowth of yeast. So about 36% of babies are born with the yeast infection in their mouth. So it's one end of the spectrum. You know, babies don't have an immune system. So people who get thrush, a yeast infection in the mouth, are infants and AIDS patients. It's like one complete end to the other. So it is very common. The problem is, with an overgrowth of yeast, the typical treatment program is a liquid oral suspension that you shoot in the baby's mouth called nystatin. Back in 2002, it only worked 1/3 of the time. Doesn't work. Diflucan is an antifungal. Take it for vaginal yeast infections. It works 100% of the time, but they don't want to give it to babies. So if you do have overgrowth of yeast, they get about 17% of the dosage through the milk. That's enough to cure them. So if you do get overgrowth of yeast, you take the medication, and as long as the baby's getting your milk, it fixes them and in them too. So you have a 1 in 3 chance of getting overgrowth of yeast. So it's definitely not uncommon. We see it all the time. One of the symptoms is white on the tongue. And a lot of people see white on the tongue, but I go, oh, it's just milk. You can try to wipe it off. Or if it is, from GERD, there's only 2 reasons for white on the tongue: spit up or yeast. If it's spit up, after they eat, it's gone. There won't be any white on the tongue. Because if it's reflux, they swallow liquid and it goes down. If it's yeast, the white is there all the time. So that's a great indicator. You could also take a piece of gauze and wipe the tongue and see if the white comes off. So if the baby's smashing the nipple, you're gonna have a wound that's straight up and down on the nipple. Just like I said, if your nipple looks like a brand new lipstick, they're smashing one side of it. So you have a wound straight down the center of the nipple. If you don't have a wound straight down the center, then it's not a latch issue, it's something else.